80%. According to industry experts, that's how often medical bills are wrong. 80%. Imagine if you got things wrong 80% of the time. Would you get paid? Most likely not. Well, your medical provider shouldn't either. Between a not-so-mini ski accident, a major and kind of gross eye infection while running through August heat in Disney World and Universal Studios, that's me with my eye patch, and that's my 4 kids on the latest Velocicoaster ride at 70 miles an hour before they're about to flip upside down. Oh, and the fact that we sell life and health insurance for a living. I'm going to tell you all about copays, coinsurance, in-network versus out-of-network medical providers, and my top 5 tips for lowering your healthcare costs, as well as what to do about those pesky medical bills filled with errors. If you already know everything you've always wanted to know about copays and coinsurance, timestamps are below this video. Go ahead and jump straight to the part on understanding and lowering your healthcare costs and medical bills. For loyal subscribers and viewers, welcome back. We love you guys. And for those of you new to Diamond NestEgg, welcome to the #1 place to learn about money, insurance, and retirement. I'm Jennifer, first-generation American, and I've spent most of my life in finance. Started working at banks like JP Morgan and Goldman Sachs at the age of 17, and graduated top of my class from NYU and Harvard Business School. And now I work on all things personal finance with business owners as well as young professionals at places like Bloomberg, WeWork, and Marsh McLennan. So copay versus coinsurance. Those of you that know me, that know us, know all about our beloved charts and tables. So here's one that clearly explains the difference between copay versus coinsurance. So first, what is it? What's the difference between a copay versus coinsurance in actual dollar terms? A copay refers to a fixed fee, say $20, that you have to pay out of your own pocket each time you visit your doctor or fill a prescription. And coinsurance refers to a fixed percentage that you have to pay. The actual dollar amount will change depending on the services, and the higher your coinsurance percentage, the higher your share of the cost is. This is one of the reasons some people prefer copays to coinsurance, because they know exactly what they should pay, what they should budget for each medical visit and prescription. The second difference between a copay versus coinsurance is when do you pay it. With a copay, you pay each time you visit your medical provider or fill a prescription, right there on the spot. With coinsurance, you're billed by the healthcare provider directly after the visit is over. This is another reason why some people prefer copays to coinsurance, because again, not only do they know exactly what they have to pay, they also pay it immediately when they see their healthcare provider. There's no waiting for the bill and no surprises on the bill afterwards. All things being equal, if you're someone who's working within a budget or someone who really doesn't like uncertainty, a health plan with a copay might be better suited for you than one with coinsurance. And if you need help finding a health plan that's right for you, drop us a note at jennifer@diamondnestegg.com to see if we can make the process a bit easier for you. Now, the third difference between a copay versus coinsurance is, does it apply towards your deductible? With copays, the answer is it depends on your health plan. Sometimes the copay counts towards the deductible, and sometimes you pay it only after you've met your deductible. So you'll need to check with your health insurance carrier on this one. Coinsurance, on the other hand, is only paid after you meet your deductible. So what's one easy way to lower your copay or coinsurance and your overall healthcare costs for this year? Here's money saving tip number 1. And this you can do immediately. Always stay in network. In-network providers are doctors, specialists, and other healthcare facilities, including pharmacies, who have negotiated and contracted with your health insurance carrier to provide medical care, services, and products at a discounted rate. Want to see the difference in rates between an in-network versus out-of-network provider? I'll show you a real-life example from my own physical therapy visits this year because of my torn ACL. See how the list price here for each of these 5 visits is $340? The list price is the price you would pay if you simply walked into the physical therapy practice with no insurance. So the list price of $340 is the same for all 5 visits because it was the exact same service each time, the exact same therapist as well. 3 of these were charged correctly as in-network. So all I owed for each of these visits after all discounts and insurance contributions was $32. For the other 2 visits though, someone somewhere along the line marked them wrongly as out of network. And the balance I owe for each of these visits is $160 versus $32 in network. That's 5 times more for out of network versus in network. Need more reasons to stay in network? Well, staying in network will typically result in lower copays or coinsurance, lower deductibles, and lower out-of-pocket maximums. If I stay in network, my coinsurance after I've met my deductible is 20%, as you can see here. So if the doctor bills me $500 for his services, I'm responsible for $100 of that bill, and my insurance company is responsible for the other $400. If I go out of network, my coinsurance skyrockets to 50%, meaning I'd have to pay $250 of that same $500 bill, not just $100. Even the insurance carrier tells me that going out of network is the highest cost option and to avoid out of network providers if possible. And if you look at my deductibles and out of pocket maximums, in network, my deductible is $2,800 and my out of pocket maximum is $6,850. Out of network, my deductible is $5,600 and my out of pocket maximum is $14,000. That's more than double. Guys, if you're enjoying this video, don't forget that thumbs up and subscribe button. This tells me that we're putting out the money-saving, wealth-building videos that you want and need for your financial journey. Which leads us to tip number 2 for lowering your healthcare costs. Another one that you can do immediately if you have medical bills outstanding. And that's check them. Check those bills. As I mentioned at the beginning of this video, industry experts estimate that about 80% of medical bills are wrong. In our own personal experience, that number is closer to 33%, but our sample size is also much smaller. But even if we believe it's just 33%, that's still quite often that we're all billed incorrectly for our healthcare. I already showed you the physical therapy bill errors before. That one was just for a few $100s. Bad enough. This one was for over $2,000. How much did I owe in the end? Nothing, it turned out. And here's another one that was wrong. This one's a few $100. And I also ended up owing nothing. Thank goodness. According to mScribe Medical Billing, billing errors result in us paying 26% more than we should on average. So how did I find all these mistakes? Here's tip number 3 for lowering your healthcare costs, and it's also something you can do immediately. Call the billing department of the doctor, hospital, or specialist that sent you the bill and ask them to walk you through each visit, each charge. You can try to call your health insurance company, but in our experience, the mistakes typically are from coding errors from the doctor, hospital, or specialist side. One wrong digit in the billing code, it's all that's needed for you or for me to be billed incorrectly. Some of the responses I got on my walkthroughs on the phone with the billing department.
Oh, wow, that's wrong. That doesn't make any sense. I think that was a coding error.
All of which had clearly also gone through my head as well. So I was glad they confirmed the errors for me. Had I not called, we would have ended up paying thousands more for medical care than we should have. Listen, not every bill was wrong, but the number of errors was shocking. If I made that many mistakes in my business, I'd be out of business. And if you made that many mistakes at work, you'd be out of a job. The good news is you know better now. And the great news is that when the billing department does find those errors, it will correct them. But it does take some time to get through all the paperwork and resubmit to your insurance carrier. So be patient. Tip number 4 for lowering your healthcare costs. Negotiate if you really can't afford to pay off the bill in full right away. When we've gone through this process with our clients, the average reduction has been around 25 to 30%. Most healthcare providers also have the option for you to pay in installments. So this is another avenue that you could consider. Whatever you do though, don't ignore those medical bills, because if you do it too often, those bills will be sent to a collection agency. They'll hit your credit report, they'll lower your credit score, and they'll reduce your chances of approval for new loans and credit cards. Tip number 5 for lowering your healthcare costs. Consider getting a high deductible health plan, an HDHP, especially if you're relatively young, healthy, have little to no dependents, and some savings. Yes, the deductible is higher, but the monthly premiums are lower, sometimes significantly. Check out our HHP versus PPO video here to learn more about the 6 questions you should ask yourself to see if an HHP is right for you. Or this other HSA Millionaire video here. We've had an HHP since we moved back to the US from Germany about 5 years ago, and one of the big advantages of an HHP is the ability to set up a triple tax advantage HSA or health savings account that you can use for medical expenses both now and in the future. And if you need help either sorting out the right HHP because not all HDHPs are HSA eligible, or if you need help figuring out the best way to become an HSA millionaire, email me at jennifer@diamondnestegg.com to see how we can give your financial journey the big boost it deserves. Moving on to tip number 6 for lowering your healthcare costs. See if they're tax deductible. Medical expenses such as copays, coinsurance, and premiums may be tax deductible if they exceed 7.5% of your adjusted gross income. If your healthcare expenses are higher than that threshold, the amount that exceeds 7.5% can be deducted. And if you're self-employed, in some instances, you might be able to deduct your health insurance premiums even if your total healthcare costs don't exceed the 7.5% threshold. Guys, thanks for watching. I hope you enjoyed all these top tips for lowering your healthcare costs. And if you have any questions about life, health, or disability insurance, shoot us an email at jennifer@diamondnestegg.com and join us next week for another money-saving, wealth-building video that's just for you.